I'm Tamara Thomas, editor-in-chief of UrbanHealthToday.com, part of the DocWire family of medical news sites, and I want to thank you for tuning in to Urban Health Weekly. Our goal each week is to keep you informed of the latest in health and medical news right from today's headlines. It's time to empower yourself with open conversations about your medical care with news that matters to you. So are you ready? Let's get started. Hi, I'm Tamara Thomas, and welcome to Urban Health Weekly, where we talk about medical news and health topics that matter to you. So I'm here with Lou and Jackie. How are you guys?
Good. How are you guys doing?
Great.
No complaints here. So did you know that dentists might find health conditions based on the condition of your teeth?
Really?
Absolutely. A visit to the dentist's office could provide a glimpse into your heart and brain health. More than an estimated 100 diseases can show symptoms in the mouth. For instance, periodontal disease, which results from infections and inflammation of the gums and bone that support and surround the teeth, is more common and may be more severe in people with diabetes. Other times, prescription drugs may affect the mouth. For instance, some drugs used to treat hypertension can cause swollen, inflamed gums. We see a lot of systemic diseases with oral signs and symptoms, said Dr. Jennifer Perkins, Executive Director of Clinical Education at the University of California, San Francisco School of Dentistry. Dentists might be able to pick up on red flags about a patient's overall health before they even start poking around in the mouth.
That's true. I remember like dentists say that they have that, checklist that you fill out at the beginning before you get your treatment. Have you filled out a checklist? Yeah, whenever you go to a new dentist, they usually have like a big checklist where they ask, have you got XYZ conditions? And then I do remember dentists, like before they do the cleaning, they do this, like, they do look over, they do a health check. They look through your, they look around to make sure you don't have oral cancer or whatever. Have you noticed they do that?
I thought they just did that regardless anyway. Don't they always just check your mouth? I don't remember. I've been seeing my dentist for so long. I mean, it's been, a really long time. But it's possible I did. I just don't remember. But I mean,
I remember I dated a guy who chewed tobacco. I remember like yeah, he used to chew tobacco. I remember his dentist was like, "What are you kidding? We have to make sure with your oral cancer to make sure that doesn't come up."
Oh, he developed oral cancer?
Oh no, not that I know of at the time, but
but they screened him for oral cancer.
Yeah. Oh yeah, that was a big deal. He was like, "You got to stop doing that."
Yeah, good luck with that one. Ooh, goodness. Perkins teaches in several courses that focus on evaluating and following up on patients' medical health histories. Through that process, we sometimes come across important medical findings, she said. Students who work with faculty at UCSF find symptoms or concerns in patients every day that might need a consult or referral to a healthcare professional. The following are some examples. Hypertension. A person's blood pressure may be taken before a cleaning. I've never had my blood pressure taken before.
I've never had that done.
Or a dental procedure that requires a local anesthetic. Never had it done for that either.
You've never had a filling?
No, I had one filling my entire life.
Wow, you have some good teeth.
And that was it. And it wasn't even a big one. He just wanted to take care of it because it was there and he didn't want it. But it was a tiny one. But in general, no, that was like one and done.
Wow.
Every contact that a patient makes with the healthcare system is another opportunity for prevention. And hypertension is a classic example of a condition where this may make all the difference. Diabetes. Untreated diabetes can lead to serious medical problems, including cardiovascular disease. In some patients, Perkins said high average blood sugar can lead to disruption in the oral microbiome, the vast collection of friendly bacteria, viruses, and other microbes that live in the mouth. That could mean gum disease, bone loss, and losing teeth. We do see this phenomenon where people who perceive themselves to be healthy may not go to the doctor because undiagnosed diabetes and hypertension can present without clear symptoms. We may just happen to see them first. Unfortunately, it's not uncommon for us to see. HIV. Perkins has treated people later diagnosed with HIV after finding lesions in their mouth that would not appear in someone with a functioning immune system. The risk of cardiovascular disease for people living with HIV is about 1.5 to 2 times greater than for people without the virus, according to the American Heart Association scientific statement about cardiovascular disease and HIV. COVID. Perkins said the UCSF School of Dentistry has tested patients for COVID-19 before dental procedures since shortly after the pandemic began in 2020 to protect students, staff, and other patients from infection. Her clinic only recently shifted to not requiring testing before procedures for people who are fully vaccinated and boosted. Research shows the coronavirus can hurt the heart and brain, and conditions such as HIV, diabetes, and possibly high blood pressure are among those that can lead to severe illness from COVID-19, according to the CDC. Although dentists can pick up on various health conditions, Kazi cautioned against thinking dentists are one-stop shop for health. Ooh, see, this is why I said, although I don't, COVID is really more screening. It's not like they found something with your teeth, but it's still essential. But I don't know if they should have, I don't know if it's right they added that one to the list, but okay, we'll go along with that. But this is why it's important to see your dentist regularly. You know what's funny? I remember a friend of mine telling me years ago that her dentist found out through her teeth that she was bulimic. She was binging. She would binge eat.
Oh, yes.
And her dentist is the one that called her out on it.
Oh.
So she stopped seeing the dentist because she was so stunned at the dentist and referred her for a mental health evaluation.
Wow.
Yeah. Yeah. My dentist asked me on more than one occasion if I have OCD.
Because you grind?
No, not because of grinding.
I grind.
He actually said he's found that a lot more people since the pandemic have started grinding. So he was, but like a lot of people are grinding now, I guess, because everyone's got tension and stuff like that. They're finding a lot more grinding. No, but he asked me because I guess because like I overbrush my teeth. Like I brush and brush and brush until it feels
because you are so meticulous.
I guess it's probably undiagnosed OCD, but I was shocked that I didn't answer the question. He was like, "Oh, your teeth look like this other woman, but she's got OCD." And I didn't say anything. I was just really quiet, like, "Oh, okay."
Wow. That was out of the blue.
Yeah, exactly. And but he mentioned it a few times. He's like,
okay.
Back to it. He's like, "Are you overbrushing your teeth? Do you have OCD?" And I would just like be quiet. And again, the same story about the other woman. He's like, "Your teeth look like her teeth." And I'm just like, "Ooh, busted." I know that I have OCD tendencies. So
okay, yeah.
Anything about it.
Well, you at least know what he thinks. That's for sure.
Yeah, well, he's peaked my game. He knows that I'm overbrushing at the very least.
Okay.
Yeah. And what about you, Lou?
Nah, I am.
Oh, come on. You're not gonna admit that you don't get anesthesia when you go to the dentist?
Well, that's because I have like a favorite breakfast place right next door, and I want to be able to eat a really good breakfast afterwards. So I'm thinking like a juicy omelet and all sorts of stuff while they're working on it. If I got to go through a little bit of pain, I go through a little bit of pain.
All right, man, rock on. What about you, Jackie?
Well, my family has a history of celiac disease, and so that can affect like your dentin and it can affect all kinds of stuff. So that always comes up. And I have complicated dental genetics, I guess. So I've had braces a bunch of times, and they just look at me and they go, "Do you grind? You clearly grind." I have to wear a mouth guard, the whole deal.
Oh, do you? I was going to ask if you wear a mouth guard.
Okay. Oh, I sure do. And I've punctured mouth guards. So I'm due for another one. They're the expensive ones. They're not like, these are like $800. So
oh my goodness.
Yeah. Yeah.
Wow.
Oh yeah. It's heavy duty. I should have a much more muscular jaw. I don't know why I don't, but
maybe that's why you look so youthful, because
you're so charming.
No, really. All right, well, we're moving on. This is remember, people, if your dentist is going to find out, don't think your dentist is not going to peep it.
Nosy dentist.
Yeah, they're going to find you out. Don't think you can hide by not seeing the doctor. Look for these articles on Urban Health Weekly, and we're going to move on to the topic. So I had an interview with the founder and CEO of Force Therapeutics. She's a physical therapist by trade, and she's created this app for, basically helping orthopedic surgeons and patients. And it was an interesting interview because I didn't realize that 60% of orthopedic surgeons do not take Medicaid and Medicare.
Wow. Think of how many people at some point are going to minimally people have like a broken wrist or bursitis or something. Like everybody at some point needs to see an orthopedic surgeon or orthopedic doctor of some sort, don't they?
Yeah. Oh, yeah, absolutely. And this is shocking. And maybe I just went to a ghetto one. I don't know, because the one I went to, every time I go there, his office is jam packed.
Wow.
I broke my wrist. I said 6 years ago, but it was actually more than that. It was probably closer to 10 years ago I broke my wrist. I didn't even realize I broke it. He's very good. I didn't even realize it was a hairline fracture. It was like so stupid how I did it. Like I had the dog free roaming in the car, and he tried to jump, and he's like all of 6 pounds, and he tried to jump, and I caught him mid-ear while I'm driving. And so the way
like a ninja.
Yeah, just, because I have pretty good reflexes. And I just caught him because he was going to injure himself or possibly go out the window or something crazy. And he was like wriggling and wriggling in my hand, trying to like get free. And somehow I injured it. And then I thought it would have gotten better. And then just doing things like making the bed and pushing the shopping cart and, using my pincer grasp to get buffet food out of the, and then next thing I know, the pain just didn't go away. But in any event, his office is always crowded. And so it was shocking to learn that so many orthopedic surgeons do not, because that's a lot of people if you think about it.
Oh yeah. I mean, that's orthopedic. There's about 20,000 orthopedic surgeons in the United States.
So figure 60% of them don't take Medicare and Medicaid.
Wow.
How many people would you say nationally with the now with the ACA, with the American Affordable Care Act? How many people would you say, Mr. Numbers? How many people would you estimate or guesstimate have Medicare?
I would think about 80 million people have the lower insurance, about 200 million.
I'm sorry, Medicaid. And Medicare probably has exploded too.
Yeah, Medicare has got to be covering.
Medicaid, about 80 million.
Total?
Wow.
And about 160 to 170 million private insurance. And we still have about 40 to 50 million uninsured.
Oh, my.
Wow.
Wow. So in any event,
But doesn't everybody know somebody who's had to use an orthopedic? Everybody knows somebody, right?
I probably.
Yeah, but orthopedic doctors are very specialized. I mean, there's hand, there's knee.
Oh yeah.
They literally just stick with the joint that they know. In terms of that, and many times they only do like certain types of operations over and over and over again. And that's just because there's so many of them. I went to one years ago, and it was a different type of experience. It was, one of these like you pay me cash, and okay,
Was this under the table?
No, it was through a referral. It was years ago, about 30 years ago. I was doing some mixed martial arts. I hit somebody the wrong way. And unfortunately, I got what was called a boxer's fracture. I didn't even know I had it until I took off my wrappings, and there's like a bump sticking out of my hand, and it was painful.
Oh my goodness!
Yeah,
painful. Oh God. So somebody quickly on a piece of paper wrote a name of a doctor and said, "Look, this guy will see you now in his office. He's like a doctor on call type of thing." So I went to his office. and he looked at it, X-ray. You know, he had the whole thing, but the office was closed when I got there. He had just like kind of opened it up for me, but he
Wow.
was just doing it because he was like the doctor on call for broken hands. So he was giving me
Oh, so he was a hand specialist.
yes, he was a hand
Cool.
specialist. Actually, he was a hand specialist that specialized in boxers and all that. And he had all these pictures on the wall of famous boxers. And I go, oh, you
Huh.
know these people? He goes, yeah, they're my patients. And I go, oh, wow. You know, I felt like honored to be there.
Wow, that's
And
useful.
so he gave me some options. He said, look, we can, you know, we can do surgery, but I can't do it right now. I can, you know, refer and I can be your surgeon, or you can go to your hospital through insurance and wait a little more of that. Or we can try and set it. Then he asked me, you know, some funny questions. Are you a pianist? I go, nah. He goes, you know, we can do this. He goes, I'm going to try and set it by hand. If we can get it to be under 25 degrees of break, you know, what they do is they take
The
the two
angle of the
pieces, yeah,
break.
the angle of the break. He goes, if it's under 25 degrees, it'll heal with a calcium thing. So I can try and set it now and all that. He goes, do you want some anesthesia? I can shoot you up. I go, nah, just let's do it. So then he
Oh,
started
God.
talking about some of the people he did
Good
it, and in the
heavens.
middle of him talking about the people, he does this yank, and my bone goes crack, and it was like, ah. So he goes, hold your hand
Wow.
right there. So then he puts like a little wet cast on it to hold it. And he so we
Was it around the whole hand or?
just around the break. It was
Okay.
think of it as a big
So around the
C.
4 fingers.
Yeah, like
Oh, it wasn't even around the whole 4 fingers. It was just on one
It
side.
was right in the middle of where the break was.
Okay.
So he puts like this little wet half a cast on, and it was just a little thing. And so we ran to the X-ray machine. He did a quick X-ray, and he saw that it was 17 degrees. So he said, "I
So
think
less than
this'll-
24, yeah.
it's less than 25." So he goes, "This is good, unless you want me to play with it some more." I'm going, "No, no, no, no. This is great. This is great." You
There
know?
are tears coming out of your eyes.
Yeah. So then he puts like a paper clip on it, like a big think of it as like the kind of clips that you put on like your Doritos to keep them fresh,
Oh, like a
type
chip
of
clip.
thing. Then he like
That's
wrapped it
hilarious.
really tight. And then he said, you know, come back in 5 days and we'll put another half cast on. It's a broken, you know, and he gave me some. He said, "This will be you'll keep this cast for X amount of days." You know,
With like a chip clip, he secured that thing.
with
Oh
a
my
clip, but then
goodness.
Elmer's glue and
it was a
Mod
metal thing,
Podge.
and he pushed it and molded it to the hand. He was actually very good.
Wow.
You know, I had a good experience with it. Then they interview you. Believe it or not, they interview you because these fractures are commonly had during domestic abuse.
Oh.
Oh.
So he said, "Well," and I got the person. He had the whole thing. I mean, he had a person who interviewed me by phone. Did you know? Do you swear to tell the truth, the whole thing? And yes.
That's incredible.
Have you where did this happen? And you explain where it happened. Do you have witnesses? You say yes. Are these witnesses available if we need them? Yes. And
Wow.
did you hit anybody in your immediate family? You say no. And then any children? No. And then they say okay. And then that's it. Yeah, it's anytime they have a boxer's fracture, they're required
I
by
find that pretty reassuring. Is that only New York?
Interesting.
yeah.
Is that I don't know. Have you ever heard of that being done anyplace else? Is that a national?
I've never heard of that period.
I don't know, but since he did a lot of athletes, you know, athletes are notorious for hitting the
Oh my
ones they
God.
love.
Oh,
For
geez.
spousal abuse? Jesus.
Yeah. Anyway, he had a whole turnkey practice there. My insurance covered some of it. Some of it I did cash because look, he got. I'm not going to call it out of bed because the break happened at 2 o'clock, and by 5 o'clock I had a cast,
And he got it within 17 degrees, which is like amazing.
yeah,
Yeah, that's pretty good.
Yeah, to this day it's great. You know, I'm left-handed. This happened to my right hand. He told me that.
Oh, you're a lefty.
Yeah, and he also told me, you know, he gave me some.
I'm gonna have to
things.
take a closer look at your hands next time I see
Yeah.
see if I see anything sticking out.
Yeah, and what happened is, you know, he also when he did the therapy part or said like, look, you're going to have a very strong grip because your tendons have kind of atrophied, they're smaller. So if you do the therapy, it'll come back. But if you don't do the therapy, you're going to have a stronger grip in your right hand than you do in your left hand. Believe it
And
or
do
not.
you to this day?
To this day, when I need to open a bottle now, I just go right to my right hand. Like,
That's
hey,
Let me tell you, the human body is so incredible. I can't.
like if
That
I can't open this pickle jar. Hand it to Lou.
so the
Exactly.
takeaway from the story is if anybody out there has a can of relish they can't open or
That's
ketchup,
I thought you were gonna say
just
something
give it to me and
important.
I'll
That's a
open it
good
for you.
story.
It was a good story. But I thought you were gonna say something important, like see your orthopedic surgeon or something. Oh,
Yeah,
leave it to Lou to like put some weird.
and
spin
that
on
was like
stuff.
it
Love a weird
on the
spin.
internet. It wasn't, the internet was just nascent, so you didn't look people up on the internet, but you looked them up by all these pictures on the wall. I guess that's how I did my research. I said, "Oh, wait a minute." He did do. I'll mention one name that he did do. He was the hand surgeon for Juan Laporte, who was a famous boxer at the time.
Wow.
He was a champion
I have
here
no
in New
idea
York.
what that is.
And yeah, this will date the whole thing. And his picture was on the wall, and I said, hey, if it's good for him, and it's good for me. So there you go.
Okay. Well, on that note, you only have one life and one body. So you got to do your best to make it count so your years are full of life and full of health. Remember, information equals transformation, people. So small steps each day and you'll see a difference. I am sure of it. So we're going to sign off. That's all the time we've got today. You guys are amazing as usual. Thank you.
Thank you.
And
All
I
right.
will see you guys next week.
All right. Bye, guys.
All right, bye. Thanks for listening to Urban Health Weekly today. I hope you'll join me and my friends next week so you can stay informed and inspired to take control of your health. See you next time.